All right. Hello, hello, everyone. My name is Gwendolyn Bork. I'm the president of Focus for our community unity and support. I am the president, and we are the Lancaster Depew, New York Addiction Prevention Coalition. Um, we have been doing a series called Addiction Prevention 101. This is a very in depth training, more or less, for those not involved in addiction to understand the strategies, evidence based, data driven strategies that we have to use in order to create population level change, community based change. And this is not something where we do one thing and it's the magic bullet. There's no such thing as the magic bullet, but there are strategies that we can use to implement, to deploy into our community to lower substance use and to create community collaboration. So, what we're going to do is we're going to go through what the government ultimately says and the strategies that have been compiled that our federal agencies say that, hey, if you use these, you will be effective. And then we'll look at how Focus has taken them and incorporated them into their action plan on an annual basis. And I'll show you our action plan that we're coming up on to our next fiscal cycle that starts in September. So I'm going to close that out. If you were to go to forourcommunitytoday.org and you were to go to the more section, you're going to see a way for you to be able to contact us as well as research. So in this research tab, there's 3 sub tabs. Our research ultimately means these are things that we have collected over data that we've collected, over the past, years since we've been involved. And these surveys that were more or less approved by the federal government, they have core measures. The same core measures are used across the whole United States so that we know as Western New York what our numbers look like versus Oklahoma, for instance, and everything cross tabulates. We can look at that and figure out what this looks like for us versus people across the country. So if you ever want to know what's going on in your local community, here's the data. And prevention science tab is really, this is all the strategies that we follow. So if you were to look at, the Drugs Free Community Program, it's through the White House Office of Drug Control Policy. That's who awarded us this Drug Free Communities grant. It's monitored by the CDC. You want to know more? Boop, click on the CDC button. If you want to know more about community collaboration, which is one of our goal, feel free to look at these particular infographics that show how each of these sectors make up an entire community, and that's how together we can make an impact. But CADCA, the Community Anti-Drug Coalitions America, that's who trained us after we were awarded this grant. They work with the federal government and the CDC and all the deputy directors of all your department heads, like the National Institute of Health, National Institute of Drug Abuse. They work with our state office for drug and alcohol use, as well as our federal office, SAMHSA, which is the Substance Use and Mental Health offices. And they've developed these strategies, right? We've been talking about this particular strategic prevention framework. That's this right here, the colorful thing. And these are ongoing and always working with each other at all times. We started with the red, we've worked our way through, and now we're at implementation. So this is what we're going to talk about today. And if you were to click on this graphic right here, it takes you right here. So environmental strategies and implementing them in your community looks like this. All right. So if we know that the first 3 strategies, provide information, enhance skills, and provide support, they assist in educating the public, raising awareness, and helping individuals make healthy choices. So generally, they affect small numbers of individuals, and they're too weak to impact the community at large. But the rest of them, so if the first 3 look at the individual, the rest of them, of these strategies, which are all right here, out of these 7 strategies to affect community change, the rest of these create population level change. So everything from enhancing access, reducing barriers. That looks like improving systems and processes to increase the ease, ability, and opportunity to utilize systems, services, That looks like access to treatment, childcare, transportation, housing, education, special needs, cultural language sensitivity. If you enhance the ability, the access that your people can get the things that they need, housing that they need, transportation, childcare, education, all those things, you're reducing the barriers to help them have an opportunity to utilize these systems and services for a healthy community. Number 5 is to change consequences. That could be to incentivize or disincentivize things. So if you're increasing or decreasing the probability of a specific behavior that reduces risk or enhances protection by altering the consequences for performing that behavior. What does that look like? Increasing public recognition for deserved behavior, individual and business rewards, or it could look like taxes, citations, fines, revocations, loss of privileges. We're going to get into that. So changing physical design, that could be anything from, changing the design or structure of the environment to reduce risk or enhance protection. It could be, putting lights in parks, changing the landscapes, signage, lighting, outlet density. And lastly, to modify and change policies. These are formal changes in written procedures, bylaws, proclamations, rules or laws with written documentation, and voting procedure. It could be workplace initiatives, law enforcement procedures and practices, public policy actions, systems change within government, communities, organizations. It could all be small p policy, as in like within schools. So if you look at, all those things, what are some of the things that, your local coalition, would be looking at? Anything from fake ID enforcement, party patrols, underage minor drinking, things like graduation parties, prom parties, social host laws where, in Western New York, they recently added marijuana to that. Like, hey, parent, like if you're going to have a graduation party, just so the kids that are bringing marijuana with them, like you're the one that's going to be charged with that. You're going to be at fault with that. So it's our job to really implement very specific things when it comes to these things. And just so you know, all of these strategies have to be incorporated in a 12-month action plan that we submit to the federal government, and they're going to say yay or nay to those to that action plan based on these strategies. If we don't have these built into our action plan, we will not be effective. And they're going to be like, why would we give you another year's worth of funding if you're not doing what we told you to do? The things that we know create population level change. So what does providing information look like? It looks like town hall meetings. Okay. Focus does a town hall meeting every year. In December, we take all the data that we've gathered, whether it be the surveys of our 8th, 10th, 12th grade students between Lancaster and Depew, our focus groups, our key informant interviews. Those are more qualitative data. It's called, it qualifies the quantity, those big surveys, which are quantitative. So we qualify the quantity of our data and we drill down into what's really happening. And then we give that to the community, to the parents, to the youth, to the educators, to the law enforcement. So everybody knows, hey, this is what's going on. This is what we're being told. This is what we found out. And we could do that then by putting it on our website. All our data is on the website. We do billboard campaigns. Last year, we worked with 2 of our neighboring coalitions that serve 2 other school districts that surround us to congratulate our adults, our parents. Hey, thank you for not serving minors during grad season, during prom season, during the summer. And this PSA more or less campaign through these billboards, we all bought billboards in collaboration with some funding that we got from New York State. And from the beginning of June until September, this message was being shown all over, because we know that when you say something positive to someone, it has more effect on saying, parents, what are you doing selling to minors or letting minors drink at your house? No, when you are positive and doing positive reinforcement, then more positive things come from that. So we did that, and these PSAs provide information about campaigns to reduce drinking and driving. So we did things like that. Okay. In isolation, so the ads in this community's knowledge, it adds to the community's knowledge of local efforts, but in isolation doesn't create long-term change. So it's a piece of it. You become aware of it, but like we all know, the seven touches of sales, there's many other things that go into effectiveness, right? Enhancing skills. This could be media advocacy on youth training on refusal skills. Hey, teaching kids, listen, if you want to go to the party, but you don't want to be like that kid, okay, have a silo cup in your hand. Maybe it's with water, but hey, at least it looks like you're a part of it, right? So there's ways to like gently let people down who are trying to get you to drink, or there's ways to look like you're a part of it without actually being a part of it, non-confrontational wise, right? So refusal skills, parenting classes, and training local treatment professionals and prevention concepts. We work with mental health professionals. We work with educators, social workers, working with parents, on social host issues, presenting the opportunity to educate parents about laws relating to providing alcohol to underage youth on private property, social host laws. That's a big one. We do a lot with that. Provide support. This is anything from like it's pro social engagement, substance free, drug free activities. Every year, Focus does Glow Fest at Como Park. It's a neutral zone between all the different school districts. We invite all the local districts and people can come. There's a DJ, there's lights, there's free event t-shirts, Chick-fil-A. There's a co-ed basketball tournament by the Boys and Girls Club. We go there because that's where kids go to drink and smoke, right? So why not go where the kids already are? And why not give them a chance to do something fun without having to do substance, right? So we do that. We do these outreach events with youth, these escape rooms, virtual reality. Come on, guys. You want to go and have fun without having to do drugs? Here you go. We pay for this. We don't want money and their financial capability to be a barrier to us or to them. So we pay for it. Sign up. We'll get you free food, free stuff. Let's go. Come and have fun and just like be a kid, right? Enhancing access, reducing barriers. These are anything that, make access to the basic services community members require to lead healthy and productive lives. So, if you're in a predominantly, maybe it's an English school, obviously, but then you have a Hispanic community converting all your materials to Spanish, or like again, financial thing could be a barrier. Like they're not having money to go and buy a ticket to Glowfest, to our music festival, or them not having money to pay for the escape room at the Galleria Mall. Well, we're going to pay for that. We're going to enhance the access and reduce those barriers. It could also be if you don't have the money, you don't have the health insurance, you need, more recently, our students need the mental health support. Okay. So we work with Spectrum Health and Human Services. They have a free program, New York Project Hope, for students and parents. Sorry about that, guys. We work with them to be able to provide counseling services for the youth and the parents for free at home, virtually. You don't need transportation. You don't need money. That's an example of that. Changing consequences, incentives, disincentives. We kind of talked about that, right? Like, hey, if we're going to go and we're going to test these local convenience stores and, alcohol, like what do you call them, liquor stores, to see if they're going to sell alcohol to minors. All right, we're going to do it undercover. We're not going to let you know we're coming, but we're also not going to like turn you into the police if you're doing it. All we're going to do is just say, hey guys, listen, we came in here, you failed. So on account of it, like we're not going to report you, but work with us. We'll educate you on responsible server training, checking IDs, like we'll get you up to speed. And that way, this is a constructive way to, to incentivize good behavior, right? Good retail practices. And then for those that pass automatically, we're going to come back with an award that says, hey, you guys did a great job. We're acknowledging your business for being a responsible server for alcohol. Like, thank you for being a great part of our community. It's always about turning a negative into a positive. What else is there? Changing physical design. This is pretty simple. It could be like I said, just as easy as we know where maybe drug use is happening, underage alcohol is being being used. Okay, so let's maybe like increase some police presence, maybe Let's get some lights going on there at night so it's not as easy to kind of gather in those spots. Let's kind of look at some of those, vacant places and make them safe so that, it's not dangerous then for these kids to be, out on the streets and, you know, being in potentially dangerous places. Um, Changing or modifying policies. It could be policies are like concrete, they're used to reduce risk or modify settings in the public health. So they're designed to structure community norms which affect behaviors. Ooh, most recently, we've been talking about in New York the legalization of recreational marijuana. A lot of coalitions across America love to say non-medicinal marijuana. Medicinal marijuana has been legalized in our state for probably a couple of years now. And unfortunately, what we've noticed that even medicinal marijuana kids get from their parents or they get themselves and they're selling it to kids in the schools. So now that like non-medicinal, aka recreational marijuana, is effective in our state, unfortunately, what we're noticing that although it was intended to be regulated, to be monitored, to be safe, we're noticing that it's not. Like there's a strain of vape shops that have already sold, marijuana related products, maybe CBD with some THC in it, even though that is illegal. And now what they're doing is instead of waiting to get an actual license through the cannabis board and getting approved for this, where it would be them getting, marijuana that is coming from a, regulated farm that's barcoded, it's measured, we know exactly, it's regulated, we know exactly what's in it, and it's going to these particular dispensaries that have laws that they have to follow. These barcodes are monitored, they know where it's going, there's the proper procedure. Well, because they legalized people being able to grow it and people being able to gift it, there's these vape shops that are actually gifting marijuana in place of selling a sticker, in place of selling a t-shirt. So, hey, come here, pay $40 for this t-shirt or this cool sticker, and I'll gift you a bag of weed, or I'll gift you this brownie, or I'll gift you, this dab wax. Like this is happening. And unfortunately, although the law enforcement is pretty pissed about it, there's nothing they could do about it to the extent that on the very news, our local news, our local district attorney said, hey guys, I'm not going to prosecute. There's nothing I can do. Gifting's allowed. So policies, what are we going to do about it? So what is Focus doing about it? We're working with the cannabis board. Please show us how we can help keep our kids safe throughout this time, how we can keep our public self safe throughout this time. And a lot of that can happen through media and environmental approaches, like, all right, social media, newspaper. We got a local column in the Lancaster Bee, networking with your members, networking with our partners in our community, using TV, using radio. We did a big TikTok contest last year. We used digital marketing on social media marketing, TikTok, Snapchat, Facebook, Instagram, YouTube. We worked with the local radio stations and then we implemented those campaigns. So all of it, this is a tough one, but we derive these actions steps from what's called a logic model. This is a hard thing to do, to wrap your brain around it. But basically, it's like a flow chart going from left to right that says, okay, well, what's the problem? Why? What's the root cause of this problem? And why here? What are the local conditions of this particular problem? And then what are the actions that we could do to intervene in those local conditions? And that's where you're going to implement those strategies. So for us, every year we create an action plan. This is our 12-month action plan. It goes from September of this year to September of next year. And there's always two goals. Goal one is to create community collaboration, and goal two is to reduce drug use. And we look at the two main drugs that we found from our data, which is alcohol and marijuana. So you're going to see the goal, you're going to see our objective, what do we want to do, and then you're going to see the strategy we're going to use to get to that goal. And you'll notice out of all these objectives, you're going to see one of those environmental strategies: providing information, providing information. Recruiting, that capacity component. How are we going to do that? Pro-social involvement, outreach events, virtual health and wellness fair. What else? Providing support by creating opportunities through alcohol-free activities. Erie County Fall Fest, we're at every year. Glow Fest, our music festival. Changing consequences for those who sell to minors. Okay, we're going to create a committee. We're going to execute the underage drinking campaign. Who's doing it? Who's not? We're going to reward the ones that automatically passed. We're going to give training to those who didn't. We're going to provide more information to youth and parents about the risk and the dangers of these unregulated marijuana products that are being gifted, that aren't being tested, and basically being created and baked in the back office of these vape shops, unfortunately. So we're going to do PSAs. We're going to have billboards about it. We're going to assess the consumption with focus groups and things like that. So overall, it's a lot of work. I think people think like, oh, we're just we're just a little non-for-profit. We're just trying to keep kids off the streets. It's way more than that. It takes a whole community for all of us to come together to ultimately, if you change the behavior, if you change the environment, you can change the perception. If you change someone's perception, you can change their actual behavior. And when you get down to the nitty gritty, that's the change that we're looking for. And that is what's going to create a drug-free community, youth filled with purpose, identity, and ready to go after, the greatest problems this world needs to be solved. And those are our future, and they're our future right now. So thanks for sticking with me. I'll see you guys next month on the next Addiction Prevention 101 series. Thank you.